part of reproductive organ, the gross part we already have studied. The part which is relevant for the practical understanding of testicles, we are going to study. So, this organ whenever it is given on the examination is usually like directed towards the theoretical understanding. So, what are the different parts or what are the different borders, folds, these have been asked. So, if you look this particular organ having like a shape of an like a oval shaped organ which is suspended through this particular tube, we call them as vas deferens. Into that particular sac we call them as scrotum. We have two of them, right side, left side, based on that particular side it belongs. Now, this particular testicles have got like a poles, we call them as upper pole and lower pole. It has two borders, anterior border and posterior border. Anterior border and posterior border easily identified by the presence of, on the posterior border, this particular sac like structure we call them as epididymis. Epididymis is having some parts as well, we call them as head, neck, body and the tail. Neck is very obscure, so head, body and tail, which continues as the vas deferens, which runs through this particular spermatic cord or content of the spermatic cord, one of them running through the inguinal region through this superficial ring to this inguinal canal to the deep ring, then moves out of the pelvic cavity, goes to the lateral wall, winds around this particular urinary bladder, goes on the back side, pierces this particular structure. If it is male subject, we have a prostate gland present to it, unless it is operated, runs through this piercing to the posterior part of the prostate gland, opens into this posterior part of the male urethra by forming a structure we call them as ejaculatory duct. Now, this particular organ, if you are seeing this particular organ which you are like looking into it, have got like a covering outside to it, we call them as Tunica vaginalis, which has got two layers. One is known as the visceral layer, which is intimately blended to it, which has an outer layer, we call them as parietal layer. Between the parietal layer and the visceral layer of the membrane, we call them as Tunica vaginalis, have a thin capillary amount of the fluid which is existing on it, and after that this particular organ have got like this particular part. So, if you just like make a section to this particular organ, as you are seeing here, looks like this. Histologically, you have seen that this testicle is divided into this particular small chambers by this particular fiber strands, and this particular region is occupied by these coils or tubes, we call them as seminiferous tubules. Seminiferous tubules, once they get straightened up, we call them as Rete testis. They form a network of this anastomosis of these Rete testis. They forms a straight form of tubes, we call them like efferent ductules or straight ducts. Then it just like a joins together, makes again kind of like a supercoiled or coiled region, and the coiled part we call them as epididymis, which is present on the posterior side of this particular testis, taking a piggyback kind of ride like a backpack, and it has a head, body and going down to the tail, and then from the tail it forms a single tube, goes out like this as a vas deferens, enters to this particular content of the spermatic cord, which along with have got like the vessels, nerves, lymphatics, which is wrapped around by these particular layers of this particular spermatic cord, 3 layers of them, and runs through this particular inguinal region and goes to this particular posterior part of the male urethra, forming a duct, we call them as ejaculatory duct, by uniting with another like gland, we call them as seminal vesicle. So, this is how this particular thing works. So, we have to know the parts of this epididymis, head, body and tail, and then vas deferens, which runs into the content of the spermatic cord, and content of the spermatic cord includes the vas deferens, which is like the content or thick content. Along with that, we have this particular veins, which we call them as Pampiniform plexus. Pampiniform plexus forms a common vein, we call them as like the gonadal vein. In case of the male, it will be testicular vein, and it has a blood vessel, we call them as testicular artery, which goes to feed this. Along with that, numerous lymphatic channels, numerous nerves, which is going to be running through this particular content and the structures. Now, whenever you are seeing this particular organ, you have to identify the medial side and lateral side of it. You see that between this particular epididymis and this particular testicle, there exists a gap here. So, this particular gap, which is we call them as sinus of epididymis, which is visible, which helps us to identify these testicles and separating out male and female. So, this particular sinus of epididymis, which is a gap between the body or testicles with this particular epididymis, which is present on the lateral side or posterior lateral side of the organ. So, this gap is visible from the posterior lateral side. Opposite side, we do not see this gap present. So, this sinus of epididymis gives us the clue to identify the testicles where it began or which side it belongs. So, if this sinus is visible to us, this gap is visible to us, we have to place this gap to the lateral side because it is present on the posterior lateral side. So, it is like that, and then with this particular spermatic cord we have to just like let it swing or let it fall. So, that is the anatomical position. Only thing that you have to do, identify this sinus of epididymis. So, out here you have to identify two things. What is testicles, which is this particular like oval structure, what it composed of structurally. If you just like break it down, cut it down, what are you are going to see this particular inside to this functional unit of it, and then you have to identify this particular epididymis, different parts of it, and sinus of epididymis to identify it based on how these things are there. Above and lower is identified by this head of the epididymis, which is bulkier than that of tail. So, head is more bulkier, and from the head it begins with this tail or this particular part, we call them as like a spermatic cord. So, see, spermatic cord forms this present in the upper pole, easy to identify upper pole and lower pole. Medial and lateral is identified by laterally or posterior laterally we have this sinus existing, medial side we do not have, so such thing. So, this is what we have to know about these testicles. Now, epididymis, the parts of it that you have to know and what this particular part epididymis consists of, and blood supply to this particular testicles that you have to know, the venous drainage and the arterial supply. Arterial supply is coming from the testicular artery. Testicular artery is coming from branch of abdominal aorta, which is coming directly from that particular artery, which is coming as a gonadal artery falling on the lateral side or posterior wall of this abdominal cavity, then going down to this particular like content of the spermatic cord and supplying to this particular organ. Return thing which is coming to the veins forms a network, we call them plexus or kind of anastomotic channel. We call this anastomotic channel as Pampiniform plexus, they do not have valves in it. So, this Pampiniform plexus, they are present as a content of the spermatic cord. Later they unite and form a gonadal vein, testicular vein in case of male subject, female subject ovarian vein, and this particular like gonadal vein runs along by the side of this particular like the gonadal artery and ends into the superior inferior vena cava, either directly or indirectly. So, in the right side testicular vein and left side testicular vein has a different drainage point. Left side it drains to the left renal vein making a right angle. Right side it drains directly to the inferior vena cava. So, this difference how this particular right and left testicular vein ends into is important. How this particular organ is supplied with the blood through this particular testicular artery and where from they are sourced, that is what you have to know. And the lymphatic drainage of this particular testicles that you are seeing here is going to get to the lymphatic groups in the lumbar region. So, the testicles usually or normally is formed in the abdominal cavity in the lumbar region, same at the point where their kidney was formed. So, kidney was formed in the sacral region, it moved up because of this change in the dimensions and the shape of this particular abdominal cavity. This particular organ which we call them as the testicles, in case of this particular formation it happened to occur in the pelvic cavity around this particular lumbar region, and they are dragged outside the abdominal cavity to this particular scrotal sac by some mechanism which is in a reverse direction with the kidney movement is happening. So, we call them as descent of testis. So, this particular descent of testis we are going to learn in embryology classes, but the testicular region which is going to drain the lymphatics from the testicles is in the lumbar region. So, that means if you have a tumor infections from the testicles there, lymphatic channels are going to drain to this particular lymph node in the region in the lumbar region. That is what you have to keep in mind. This is very important, surgical importance for this blood supply, venous drainage and as well as lymphatic drainage of the testicle is concerned, which is very high area. This is what we are talking about, this venous drainage, arterial supply and this particular lymphatic supply. Now, coming to this particular outflow of this particular seminiferous tubules, which forms this epididymis, and epididymis forms the vas deferens reaching to this particular lower pole of this testicle. Then it moves up, runs into this particular seminal vesicle. So, this vas deferens enters to the inguinal canal, and this particular entry to the inguinal canal getting into this particular lateral to this particular inferior epigastric vessel. Once it comes out of this particular abdominal cavity, runs to the lateral wall and goes to the back side of the urinary bladder. Once it goes to the back side of the urinary bladder, lateral to it, it finds this particular organ placed. We call them as seminal vesicle. The duct of the seminal vesicle and this epididymis or the vas deferens, these two ducts unite together before entering, make a common duct. We call them as ejaculatory duct. That ejaculatory duct pierces this prostate from the back side and enters to this particular or empties into the prostatic part of the male urethra. So, we have seen this particular prostate in theory class, and the features of the prostatic part of the male urethra, we have to know where this particular ejaculatory duct is opening into. So, those features of the prostatic part of the male urethra are important. So, this vas deferens that we have to keep in mind, how this particular vas is formed, where from it is coming, superficial ring, inguinal canal, deep ring, then it is coming out and then entering into this particular region, we call them as seminal vesicle. This is a vas singled out from this epididymis. This is your epididymis head, body, tail, and then it tails comes here, is a vas deferens you are seeing, and it becomes coily as it goes up, becomes straighter duct, and then eventually it drains into seminal vesicle along with this particular thing formed with as a ejaculatory duct. Now, this vas deferens, before it ends into, it forms a dilated part, we call them as ampulla or ampulla of vas. Then it joins with the duct of the seminal vesicle, forms the ejaculatory duct. So, how this ejaculatory duct is formed? This is how the ejaculatory duct is formed. So, we are seeing this particular urinary bladder schematic picture, this one as well, this one as well. So, this is the urinary bladder, you are looking at the back side, this is the prostate gland, this is the vas deferens, this is the ureter coming from above, posterolateral side. Now, this vas at its end, it is dilated. This dilated part we call them as ampulla, and next to it, lateral to it, we have a duct or gland, seminal vesicle. The duct of the seminal vesicle, see, unite with the duct of vas deferens and unite to form a common duct. We call them as ejaculatory duct. So, there are two ejaculatory ducts are there, right side, left side. What do? They pierce this particular prostate gland and run into the prostate gland and then empties into the prostate part of the male urethra. So, this prostatic part of the male urethra where this particular seminal vesicle and this particular vas deferens unite to form. So, this is how you are seeing here cross sections of the urinary bladder. This is the prostatic part of the male urethra, and you can see this particular prostatic part of the male urethra out here. You see that this particular thing we call them as ejaculatory duct, ED. So, this ejaculatory duct running through this particular prostate gland pierces and opens into this particular tube, we call them as urethra. This part of the urethra we call them as prostatic part of the urethra. This part we call them as pre-prostatic part. This part we call them as membranous part. Then this part we call them as bulbous. Then we call them as penile. So, different parts of this urethra are there. You have to know different parts and the different naming of them. So, this is how this particular whole gland and whole organ is, you have to learn. Functions of the seminal vesicle is that they produce this fluid, we call them as seminal fluid, which this particular fluid mix up with this particular content of this particular vas deferens, makes this particular bulk of the semen and runs to as an alkaline media into this particular semen, so that this particular semen can survive, get some nutrition from this particular region like fructose, zinc, etc., and these particular things are coming together once this ejaculation takes place. So, this ejaculatory duct, you have to know how this ejaculatory duct is formed, who makes this ejaculatory duct, and where do the ejaculatory duct opens into. This is very important, you have to know basic facts. So, this is about what you are seeing here, prostatic part of male urethra zoomed out. This part we call them as this sinus of this particular prostatic part of male urethra. Here on the sides of the sinus, besides this elevation, we call them a seminal colliculus. We have this particular opening of this ejaculatory duct. This is 1, this is 2. These are the 2 openings of the prostatic part of the male urethra, or sorry, ejaculatory duct, which is opening in this particular organ. So, this is what you have to know about this particular prostate gland. So, once again, blood supply, venous drainage, lymphatic supply, this is what you are going to identify. Besides that, you have to know this particular epididymis, parts of the epididymis, and vas deferens, how this vas deferens ends into, what do you mean by the ejaculatory duct, where do the ejaculatory duct opens into, content of the spermatic cord, etc., that you have to know related to this anatomy onto this particular region. So, whenever you are seeing this particular organ given to it, you have to identify above, below. It has anterior border, posterior border, medial surface, lateral surface, easy to identify based on some features. Above and below is identified by the presence or attachment of the above and below is identified by the presence of this spermatic cord, which is present on the upper pole, and medial and lateral is identified by the presence of sinus of epididymis. So, if this particular organ is present, that you have to identify the upper pole and lower pole. Once you have identified this upper pole and lower pole, then you have to look for this particular sinus of epididymis. You make a vaginalis which has got two layers, outer layer and inner layer. Outer layer we call them as Rete layer, inner layer we call them as Visceral layer. Sinus, I have made it clear, which is sinus. So once you identify the sinus, place it to the lateral side. This thing will take care of it all these two. Above, below, anterior and posterior will be adjusted on you. Only you have to identify the sinus of your epididymis. That has to be placed lateral side. So laterally you place it. So if it belongs to the lateral side, that means if this belongs to the left side. So you have it on the left hand. That's it. Then this is clear. And epididymis have got three parts: head, body, tail, and then it is the vas deferens. This is the vas deferens is coming out. Going and uncoiling and moving straight. This is spermatic cord. With this covering, content of the spermatic cord, periodically. Equal side. तो देखिए, अरे, लास्ट कुछ इसके ऊपर होगा, ये इसके ऊपर बहुत